finally, a source of raw, real, and honest information on healthcare issues that matter most. Welcome to BS Free MD. From the latest medical information to how to stay sane as a doctor or a patient, no subject is taboo and no BS is allowed. Now, let's welcome your hosts, Doctors May and Tim Hindmarsh.
Hello, everybody, and welcome back to another episode of BS Free MD, coming to you live from our new studio. If you're watching the video recording, check out our sexy new background. And if you're just listening on the audio, well, then you'll have to believe us. Anyway, today's episode, I don't know what Tim wants to call it, going in deep, or Tim loses his shit, or Tim's extra weight loss journey. Anyway, we're gonna leave you hanging there for a couple minutes to hear what we're gonna talk about today. But before we dive in to Tim's medical stuff, I'm trying to drop some funny hints, but it's not really working.
Oh, I dropped a lot, and it was a lot more than hints.
If you are following our Instagram, you know what's going on. We're going to share a little bit about Tim's adventures this week. But anyway, before we dive deep into that, our sponsor this week again and this month is Oregon Valley Farm, which is a local Willamette Valley company that we love, we use, and we want you to know about them. Their products are amazing. They have organically raised, non-hormone, pasture-raised meat products, beef, chicken, pork, that is sourced from different farms in the Pacific Northwest, from Washington, lots of Oregon cattle ranches, and some in California. And you can get subscription boxes shipped right to your door in many states. You can do local pickup if you live here in the Willamette Valley. But let's just say that this is the best and healthiest form of getting your beef and your meat. As like we've said on other episodes, the chicken it tastes like nothing that you'll taste in a store, not even Costco chicken. I'm going to say it.
Really, good. The only way that they could make this meat more real is if they literally just brought the cow to your house and had it grazing on your front lawn.
Yeah. So it's sustainable and ethically raised, hormone-free, pasture-raised, grass-fed. You can get grass or grain finished beef, and super high quality. And we've had other subscription boxes to other places. The beef, this is the best beef. I'm biased. Maybe it's the Oregon soil. I don't know, but super great farms, great family. So check them out online at OregonValleyFarm.com. They have specials going all the time with discounts and coupon codes. So check them out again. No coupon code from us. Just go to OregonValleyFarm.com. So I'll link that in the show notes as well. And check out our social media, because we're always linking their stuff as well. And they're on Instagram and Facebook. All right, Tim. Well, I'm going to let you, I don't know, where do you want to start? If you were following our social media this week,
which you should do, because it's pretty funny.
And most of it, I think Facebook, sometimes it doesn't flip over there really well, and it doesn't capture.
Well, so Instagram is
the best place in our stories. You could see that Tim was having a lovely time drinking a new cocktail he made, which he dubbed the Shatini.
Yes, because I had my 4th colonoscopy. I was confused. I said it was my 5th.
I know. I was doing the math, and I was thinking, I didn't think it was.
Well, no, I started almost 15 years ago. So it was initially I had them every 3 years because of my family history and because I had colon polyps.
And tell everybody why you started so young.
Well, because my dad had a villus adenoma, which is essentially almost a colon cancer at 50. So then you start 10 years before the youngest family member had cancer, if it's a cancer diagnosis. And so for me, that would have been 40, and I was a little bit late. And then I actually had polyps.
On the first one you did?
Yeah, it was 40. So then it was crazy. Every 3 years for a couple times. And then I was out to every 5, because they go in there and harvest the polyps. It's actually quite fascinating, because we've obviously cast a lot of aspersions on a lot of stuff that goes on in medicine because there's a lot of BS out there, like a tremendous number of things that really don't work and definitely don't work the way that they're advertised. Colon cancer screening, especially colon cancer screening for the correct patient, is unbelievably effective.
So
And the reason it is because colon cancer, if caught early and only in your colon or caught before it becomes cancer, like in my case, you can remove those nasty things that will become cancer, and you're either preventing getting colon cancer, which is a virtual 100%. Like for me, you wait long enough, it'd be a 100% guarantee.
Yeah.
And for people that have early diagnosis of actual colon cancer, it's a surgical cure. It's not a surgical treatment, it's a surgical cure. And there's very few things out there in the cancer world that are surgical cures. Like people think, oh, well, lung cancer early, certain kinds of lung cancer can be a surgical cure. Testicular cancer,
I'm thinking appendicitis.
Yeah, I mean, it's really crazy. So
but that's not a cancer.
It becomes really important.
Some things are definitely worth doing
because if you let it go, there's virtually no symptoms, right? Like very few people will get.
Well, if there are symptoms,
usually by the time you get symptoms, you're gonna die from it. But some people are really lucky and they start bleeding, so then you can diagnose it. If it's early enough and it's just in your. But once it's left your colon, it's basically palliative treatment. I mean, there's definitely better treatments now as far as extending life, but you're not getting cured.
Well, most people know somebody that's had colon cancer. I mean, my grandmother died from colon cancer. She basically got diagnosed when it was metastatic. She just ignored it, had bloody stools, didn't say anything. And that's a common thing for a lot of people. We've seen patients, they are too embarrassed or they think it's a hemorrhoid and they just don't want to get checked.
Well, I had a friend years and years and years ago. I mean, this is 20 plus years ago. And he had a really bad family history. And he's like, no one's going to stick anything up my rear. And he died at like 40 some years old. I mean, really? You know what my solution to the things in my rear is?
Passing out so that you don't let anybody put it up there?
Well,
which is basically what happens.
My goal is always to make sure that the OR staff is laughing before they do anything to me. So I wheel in there and it's all real professional. And they were tremendously professional. We'll get into some of the complete idiotic stuff that went on prior to this procedure. But I get in there, they wheel me in the room, and I got an IV in, and I talked to the nurse anesthetist who's going to give me propofol, which is the greatest thing in the history of mankind. Like that stuff, like instant sleep, just a great sleep. You dream, you wake. It's just awesome. And so I roll in there, and they're saying stuff to me, and they give me a blanket, and I go, oh, that warm blanket, it feels like I just peed my entire body. And they're kind of giggling because they're used to people being really nervous and freaked out. I damn near lived there, right? So they come in, and I said, look, that your anesthesia better be good because I have a 2-drink minimum for butt stuff. And they just love that.
I'm sure they did.
Because you know what, like your entire day is just like ramming things up people's rear.
Yeah. Most people are nervous and don't see the humor in it, I guess. Although
yeah, but
there's always the smart asses like you
that's right.
Can't get away without
I should have just put
comment.
I should have written smart on my actual ass.
You should have.
That would have been. What is that?
I'm gonna go on a bunny trail like you do here. But while we're sitting here looking at this video, if anyone else is, I can't help notice, but Tim's surrounded by 2 mays. One on the right and one on the left with the photo that's there. It's not very funny for the people listening to the podcast, but it's pretty funny if you could see it. There's a picture on the wall that has our logo with us on it, and I'm sitting on Tim's shoulder, just like, I don't know if that's the devil or the angel whispering in that ear. I'll have to decide one on each side. Anyway, well, before we share more fun and games that you had, let's talk a little bit, because I'm all about the data and the info on screening for colorectal cancer. And this is sourced from the U.S. Preventive Services Task Force, which has really good recommendations for
it's probably screening. The best scientific information on screening. And it is a very small handbook because there's very little stuff that works super, super well for screening.
Right.
And screening needs to be narrowed into like the screening the right person at the right time. That's really critical, right? So that you get the most bang for your buck. You get because, for instance, because colonoscopies are not benign procedures, right? Like you can perforate someone's bowel, you can cause them to have, surgery, you can bleed, like it's not like it's nothing, right? It's not like it's
It's not like it's looking in someone's ear for an ear infection.
right. And so, I mean, again, with skilled operators, the complication rate is exceptionally low, but it's not zero, and it's definitely way more than
Well, we know family members, people, patients that have had a screening colonoscopy and had a complication, bleeding, or other things go on from
well, yeah,
the
and
procedure.
some
So,
people have very tortuous colons, and it's mechanically
right.
difficult to
So
actually
anyway,
get the scope in.
back to where were you going on this?
So who should be like
right.
what can you do for screening, and who should get it?
Okay. Well, first off, the reason we should be doing screening is because colorectal cancer is the third leading cause of cancer death for both men and women, period. So, as far as cancers go, number 3 across the board for men and women after lung and
Breast cancer.
Breast cancer, yes. So,
but strangely, lung cancer is still number 1.
Yes.
And it is essentially only in smokers, which is mind-blowing that it's still number 1.
Right. So the most frequently diagnosed age range is 65 to 74 years of age. But that's that means you want to start screening earlier. So get this, they estimate that 10.5% of new colorectal cancer cases occur in persons younger than 50 years of age. That's significant. And the incidence of colorectal cancer in adults 40 to 49 has increased by almost 15%. That was from 2000 up until 2016. So obviously it makes you wonder, is it what we're eating, or is it the no screening? And basically,
well, are we just looking for it more so you look for it because you find it, right?
So they say that in 2016, 26% of eligible adults, so that's a quarter in the US, a quarter of eligible adults in the US had never been screened for colorectal cancer. And in 2018, 30% were not up to date with screening. So it's rising. So I don't know. In 28, that's pre-pandemic, 2018. So it's not like people stayed at home from COVID and didn't get their screen. I wonder what it is now. I bet it's even higher because of COVID. So that's the importance of it. The recommendations for screening, as far as what do you do for screening, they're varied and lots of options. So back in the day, everybody used to remember coming to us to the doctor's office where we do a rectal exam and do a little test in the office. Now that's not standard of care anymore. If you do that, you need to actually take that kit home, and it's called a fecal occult blood test. And if you do that, you have to collect 3 specimens, and you'd have to do it every year. So basically, you get the little cards.
And there's dietary problems, like you can't be eating a bunch of rare steak.
Exactly.
Because you'll turn the test positive.
So yeah, no beets and rhubarb and other things like that will turn it positive. So you have to follow a really strict dietary adherence. I think it's for 5 days ahead of time. And then you have to collect 3 stool specimens that you smear on a card, send that in. And that's basically the first and oldest test that there is. The next one that you can do, stool-based test, is called a FIT test. That's pretty popular now and well-known. And a FIT test is basically done yearly, and you actually collect a stool specimen at home, 1 test, and send it in. It's a single sample, and I don't think you have to do any kind of special dietary
and that's
restrictions ahead of time.
A genetic test, right? It looks for...
No, that is not the genetic test. Then there's one called a sDNA FIT test. That's the Cologuard test. So if you've seen that little box guy on TV bouncing around for Cologuard, where they mail the kit to you and you mail back in, that's the DNA FIT test. It can be done every 1 to 3 years. It's more specific. So what they do is you collect a stool specimen, entire stool specimen, in some cases, the entire bowel movement is sent in, which really does not sound like fun. And then they analyze it not just for occult blood, but also they look at the cells to see early genetic changes.
So you have to send in an entire load, like an entire steaming triple coiler.
I know my dad did Cologuard, and I don't remember him sending in a whole stool thing. So I'm gonna go out to the masses here and let you all write back to us on this one, or we'll look it up. But usually the fit test, according to the USPSTF, it says that the highly sensitive DNA fit test requires entire bowel movement to be sent in.
Well, that's right from the.
And it's more specific. I think the fit test is 79%, and this one goes up to 93% effective in detecting any abnormalities. And you can go 1 to 3 years on it. So there you go.
Wow.
Or if you prefer the easy way out and don't like to play with your poop, then you can do direct visualization tests, which are the colonoscopies, CT colonographs, or flexible sigmoidoscopes, which aren't too in vogue anymore. And so basically, a colonoscopy is done every 10 years if everything's normal, and it involves a trip into the day surgery unit in which the gastroenterologist puts a long tube from the rectum all the way up to the end of your colon to the small bowel to look at the entire colon for early changes, little abnormalities. If there are, they can biopsy them.
So the advantage of that test is it's direct visualization.
Exactly.
So if they know what they're doing, they could see it. Plus, they could do biopsies. Plus, if they're doing biopsies and you have adenomatous polyps, which are precancerous lesions,
they can take them out.
They take them out, and then they can't become cancer because they're gone.
Yeah.
So for somebody like me that has a significant family history, like doing all these other tests doesn't make any sense. You go straight. Like if you have a significant family history, it's really easy to know what you should do. Like if you're a parent, first degree relative, so that's brothers, sisters, kids, or parents. If you had a first degree relative that had colon cancer, you go 10 years before their age.
Right.
So that one, that's easy.
We'll get to when we'll get to the when to start the screening, but I'm just explaining the different tests.
And you get a colonoscopy.
You can do a CT colonograph every 5 years, which
there's no way in hell I'd have a CT scan every 5 years.
Yeah, no.
I mean, I would assume that's lower radiation.
You still have to do the bowel prep,
but
obviously.
That's still a lot of radiation.
But you don't have to.
Well, you still have to do the bowel prep.
No, I know.
You still have to literally.
You don't have to get put out. This is the big thing. So.
Yeah, but that's the best part.
Of course it is.
I mean, it's just like. They treat you nice. The nurses are super, attentive. And
so there's no anesthesia or sedation. You get to drive yourself into it because you're going into radiology.
No, the whole reason, the whole bonus of like literally having to wear a Joe Biden diaper for the entire night is because you get the good drugs at the end of this. That's the whole point.
Anyway,
that's the cherry on top. So no, I wouldn't do that. I would do a colonoscopy.
So then flexible sigmoidoscopy.
That's out of style.
It's kind of out of style.
That's like
and
bell
usually
bottoms,
it's only done in some areas in like the Great White North of Canada, for instance, when you can't really get into a gastroenterologist because they're so booked up. And we used to do these, not personally, but our partners would do them in clinic. We would usually hear screaming and yelling down the hall from the ensuite room because they put this tube only goes up into the left side of your colon, into the sigmoid colon. So you don't get to get a full view, only on the left side.
Well, and the old ones,
and you have to pump air in to a giant balloon in order to see. So
and the old ones were rigid.
Yes.
So they were like an 18-inch pipe that went in your rear and then filled up with air. Like honestly, it's kind of like, it's sort of like,
well, you don't even have to go what it's like. I'm thinking people can pretty much imagine that.
Well, I'm imagining it would be like your first night in the state penitentiary. That's what I'm thinking it would probably be like.
Set Said a man.
But worse.
Said no woman ever. Anyway. And then you can do flexible sigmoidoscopy with a fit test as well to increase your yield on testing. But then there's risk of false positives and then having to have a colonoscopy anyway. So pretty much most people choose between doing the fit test every year or the highly sensitive one, the DNA fit
every
test.
3 years. If you're normal risk,
And-
that's the key.
and-
If you're normal risk.
and or the colonoscopy. So yes, good question. Screening. When do you start screening? So they say that the highly sensitive fit test, like I said, it's yearly. SDNA fit test every 1 to 3. The CT colonograph every 5. Same with the flexible.
Starting at
SIG.
what age? 45?
They recommend starting at age 45. Yes, correct. Not 50. So they recommend screening 45 years of age. And then it depends on your family history, because if there is a family history of colon cancer at a younger age, if you have things like familial polyposis syndrome, Lynch syndrome, where people tend to develop fatal carcinomas, then it's usually 10 years, I think, prior to the diagnosis. So it could be earlier. Anyway, or if you're having other signs and symptoms that would predispose, you're having bloody stools, abdominal pain, abnormal findings on an X-ray or CT scan. I mean, of course, it'll be easier, but just for screening.
That's a good one to really discuss with your doctor because it is it's not nuanced really, this is fairly linear. But the bottom line is if you're past 50 and you have had no screening at all, no matter what your history is, you need to get screened. If somebody in your family was had polyps, especially if they had colon cancer, then run, don't walk. But lots of these people, we've patients, friends, etc. They hadn't really any history, didn't do any screening, and then all of a sudden they get really sick, and it's like, what the hell's going on? Oh, well, I got metastatic colon cancer. Well, whoopsie.
So what about people that are past the age of 76, 75? The recommendations are what they call C level. That means it's selective screening. It would depend on your risks. If you've had normal colonoscopies all your life and there's no family history and no problems, then your doctor might suggest that past 76, you can discontinue. I mean, that's just between
if you have normal risk and have been screened by whatever recommendation, whether it's annual fit test or every 10-year colonoscopy or whatever the case may be, in that scenario, then there's probably zero reason to continue doing the test, because at that point, as you get older as well, the risk benefit ratio with regards to screening compared to not screening starts to get way out of whack.
Basically, the net benefit so small that you
but
run
you're
into
still
the risk
absorbing
of perforating the colon. People could be on blood thinners by that time. I mean, there's so many other things.
Well, you're absorbing risk too,
exactly.
Right? Because you're absorbing the risk of having the procedure in your late 70s or your early 80s.
Yeah, sedation's not benign. People think it's no biggie,
but it is delicious.
We know you love it. Yes. Risk factors for colon cancer. I'm going to throw out really quickly. Basically, risk factors increase in people. So across the board, men and women. I don't know who is at higher risk. I don't know if they've studied that, but I do know that if you're African American or Black descent, American Indian or Alaskan natives, your risk is higher. And then obviously with the family history of colon cancer, Lynch syndrome or familial adenomatous polyps, that's where your family produces a lot of polyps. I was wrong. It is men. Men are a little higher risk than women. And persons with other risk factors, including obesity, diabetes, long-term smoking, and unhealthy alcohol use. There you go.
So what is unhealthy?
So I'm adding up all the boxes for you.
Well, there's none. Just my family history. I'm not obese.
No, you don't have unhealthy alcohol use.
Very often.
Anymore. After sober October. Right. No, I'm kidding. Oh, anyway. So there you go.
Yeah. So, So
this episode is mostly to talk about Tim's experience, not for all the
Yeah,
data
but
on
it's
colon
really
cancer
important
screening, but I
because
think it's really
because we have
important to share
people,
that because
yeah, like we have people that listen to this that don't go to the doctor, and we're actually big proponents for not going to the doctor, like massive proponents for not going to the doctor. But there's a few things you should get checked, and it's kind of like you really, really, really need to get a few things checked. So if you've never been to a doctor for years and years and years, yes, you need a blood pressure check. You might need some lab work just for giggles. It might help, doing cholesterol, maybe.
you might need your blood sugar tested.
Get your blood sugar tested, that kind of stuff. And then there's a few screening things that are really helpful. And this is one of them. And I mean, the downside risk
I would say
is so massive at certain ages. Like if you're 55 and haven't been to a doctor since you were born, you probably should go. And this is absolutely something you should discuss, because this is something that, is very treatable at the correct, if it's early enough,
Right.
and very deadly otherwise. Like it's a massive it's not like breast cancer screening, which is really nebulous. Honestly, it's really nebulous. It's like
that's for another show, but
that's an entirely other show. But it's it's kind of like, does the debate? We'll just say it really briefly. The debate in breast cancer screening is, does it really save lives, or does it make the diagnosis of breast cancer so early that women just survive way longer with a diagnosis rather than actually saving their life?
The data would argue with you that it does.
It does now. It's
morbidity and
taken a
mortality.
long time, and it's still like mammography. There's way better tests like breast MRI. And it's like the breast cancer screening is that's a really tough one to parse out. I love what the United States Preventive Services Task Force does on it, which is 50 every other year, and after 50 for women, which I think is, for standard risk. And again, this is why you go to a doctor, okay? Because who you are, what your family history is, whether you're male or female, for breast cancer, whether you had kids or not, all of those things factor into how aggressive you get screened, because none of these screening tests are benign.
No, it's not one size fits all. It's not a complete algorithm. And that's why monkeys can't replace us as doctors. There is an art and a science to be combined.
Yeah, there is. A lot of this can be done by, but again, I don't want to bunny trail too much.
No,
most of healthcare can be done in a gym. Like that's, the most efficient healthcare in the entire world? A gym with a bunch of colon cancer and mammography screening posters.
Well,
so people remember,
because you're going to reduce your risk factors, right? Put out the butts.
Yeah, but that's not how we do it.
And
it was never, like even if you look at COVID, and if you put aside all of the early treatments for COVID and all of the debate about whether the studies were good for ivermectin and hydroxychloroquine, if you just ignore that, okay, if you just ignored it, and there was stuff that is absolutely 100% there's no question that it was helpful, and it was never discussed. It was never lose weight, get in better shape, take vitamin D. Those things were absolutely 100% correct. And we interviewed people that just read the data.
Well, people know
and
that.
They're like, I lost 60 pounds because I didn't want to freaking die of COVID, and it was a good excuse to lose weight. Like, it was crazy. But why didn't they come out and say, we're getting slaughtered because we're, pigs to the slaughter, and it's time to change the way we eat? It was never that. It was always some super expensive technical way to treat it. And it's just insane.
Well, let's start talking about the fun stuff. So, you don't have the picture. So
what?
I was gonna.
The
picture. So start the picture of you chugging your 1 gallon of salty Gatorade.
Yeah, I usually get about 2/3 of the way through the. I don't know how. Actually, my phone is ringing, and I think it's the colonoscopy people.
Oh,
honestly,
I was gonna say.
No, seriously,
my phone goes off in the middle of a podcast.
I have it on silent.
The angry eyebrows from VeggieTales.
Yeah, and they're literally they're calling me to make sure that I didn't die.
And after the podcast, I'm paying for it.
No, I know. You put it on. Why put it on Do Not Disturb if it just disturbs? I'm just gonna put it on disturb from now on.
Maybe that's your girlfriend in your favorites.
Yeah,
'Cause
it's
that
not in
little
my
ring,
favorites.
anyway.
But anyways, I'll get that. I'll get that. I'll play the message. Hold it up to the mic. Okay, so yeah, so it was an interesting experience this time because it's the first time I've had anything done medically during the COVID era, which wow, if you want to piss me off.
Well, welcome to my world. I've been with all my medical stuff, which is not about me this show, but I've had some issues going on lately. I've been all over the place, and I've pushed my buttons enough when I go in because it's Oregon. So the Oregon Health Authority says we have to keep wearing masks in medical
Yeah,
facilities.
even though the CDC
And
changed
it will
that.
be through flu season, which means it'll be through the end of June, and then they'll revisit it, and they'll probably
Wow,
still
and
just ignore it, and we'll be wearing masks forever.
depending on how many votes they actually count, you'll probably be wearing a freaking mask for the rest of won't matter because we won't be here. So enjoy.
So wait, but I thought you were going to tell them all the fun you had doing your prep.
Well, yeah, I usually get about a liter and a half. Like it's 2 liters, and I get maybe 2/3 through.
And I had something different than you, and every gastroenterologist does it different. Like my sister works in endoscopy, and she said that they all have different ways of doing the prep. It's personal choice. But I must say,
I didn't do what they said.
I like your way better because
my way's better.
I had the 2 bottles that were like a liter each, and had to drink one the night before, really late at night. And it didn't. I documented mine on Instagram, but basically I started drinking it 12 hours before my procedure, and I was like waiting for 4 hours for anything to happen. So then I was up late, early morning at night. And then I was supposed to drink the second bottle before going in.
Yeah, 3:30 in the morning.
And then we're literally driving. How many miles is that from our house to there?
Yeah, 40.
I thought I had to stop at like these truck stops and thought I was gonna like lose it in the car. I mean, that was stupid. The second bottle, I'll never do that again. Yours,
I do it old school. The old school way is to basically fast.
They give you the 1 gallon
for a day before. Have just a liquid diet, like clear liquid diet, which is essentially fasting, and then start in the afternoon.
Eat a whole bunch of corn on the cob.
Yeah, I always do that just to get even with them. What did you do? Well, I ate corn on the cob for 3 weeks. Enjoy. No, so what I do is, and then I started in the middle of the afternoon and drank.
You hogged out at 3 o'clock. And
about
then at
half
4 o'clock,
of it.
You started chugging that stuff.
Half of it. And then, the explosions for me start.
All right. They don't want to hear.
Hour.
They don't want to hear this part.
No, it's just like, yeah, it was crazy. And basically you keep drinking this and drinking a ton of water as a chaser, because this is essentially salty, soapy with a hint of lime.
All I know is they try to make it palatable, but I almost threw up last time.
Yeah. And
it
so
just sits in my gut.
So
forever.
And then the goal is basically you keep having wicked diarrhea.
Well, what goes out should equal what goes in.
Yeah.
Basically.
You basically have to turn your poo to pee. And once you've turned your poo to pee, that wasn't at a place I went to in Nepal, poo to pee. And you change your poo to pee, and then you're cleaned out.
Pretty close.
And then you go in, and I've never had a prep problem. They've always said that my prep was good.
Oh, you're proud of yourself, aren't you?
Well, yeah, and I am so proud. Check this out. Look at that. There is my actual colon.
That's very pristine and shiny.
Yeah, minty.
I wouldn't be bragging so much though. Look in that left upper quadrant there. Those sassy little growths.
Look at that. Just the tiniest little trying to kill me.
I'm surprised he could even see that.
And just minty fresh prepping. Minty fresh. Absolutely unbelievable.
Yeah, I don't see any. What was that gastroenterologist we had when we did our training? She was always saying it looked like Star Wars, dive bombing all the asteroids of the poo balls of people that don't do their cleanse.
Well, but they also do emergent endoscopy where somebody coming in is bleeding, and there's no prep in that, and
there's no worse thing to do in medicine than a colonoscopy on someone that's bleeding. Mm-hmm. Or a GI bleed. That's awful. Anyway,
yeah,
or upper GI.
So minty fresh. I had a minty fresh colon.
But you were going to tell everybody about your experience in the COVID era going to a medical facility, and your train of thought. I needed to reel you in.
That's good. That's why you're here, and that's why we stayed married. That's the only reason, actually.
That's all I'm
is
here
just
for.
just to completely direct me.
I own the reel.
Just reel it in.
I'm a fisherman of your thoughts.
Reel it in. Reel it in.
There's not much on the end.
So
It's a
anyways,
dry tap.
we get there, right? And I'm like, it was like going into one of those caves on one of the Pacific Islands, and you find, and it's 1963, and you find the Japanese guy that's hunkered down in a cave that still thinks the war is going on. That is literally the experience, because we drive there and we have to drive into a special slot and then call them to tell them that we're here. And then I can go in. May couldn't come in.
Well, I could come in,
but you couldn't leave.
But I wasn't allowed to leave. So I
then
said,
you'd have to sit
that.
in there for 2 hours. I'm like, this is stupid. I'm just going to go in there. They're going to do a bunch of stuff to me. I'm going to read a book. Then they're going to put me to sleep with the absolute wonderful Michael Jackson juice. And then I'm going to wake up and leave. That's kind of.
It's like having your husband come with you to the hair salon while you get your hair dyed. Like,
right.
What's the point in this?
Right. So I just said leave. Okay, that's fine. So I'm like, well, what the hell is going on? Like, why? Like, you're separating people still? Like, didn't you know Beijing Biden told you that the pandemic was over a long time ago? So then I go in there, and again, everyone is super nice. I'm not going to throw any shade on anybody. Everybody was super nice and super professional. Outstanding care. Great. Okay. But I get there. And it's like the check-in area is like a glass window, because that's what it's like. It's like going to a bank, right? And it's always been like that. They're all wearing masks, and the person checking me in puts on a pair of gloves to type on the computer all my information. And I just sat there, and honestly, I'm surprised I wasn't bleeding out of my mouth. I was biting my tongue so hard. I'm like, why the hell are you wearing gloves? Like, what are the gloves doing? What? Because you have to slide a piece of paper to me and you might have contact. So like, I'm sitting there, I'm like,
because I said, you got to give people the benefit of the doubt. Maybe she has SID, like subacute combined immunodeficiency syndrome.
Well, no, because then everyone had it, because they were all wearing gloves. In the reception area, they're wearing freaking gloves, right? And I sit there and I go, no, this is just a show.
So they wore gloves, but the gastroenterologist didn't. When he put the tube in your butt, is that what you're going to tell us?
No, of course, no, of course. So then I go to the back, right, and they check me into the surgical area, and again, fantastic, like just outstanding care, like very just efficient, to the point. Really good, asked me a million times what my name was, what's your date of birth, what are you here for? Like, it was just great. Okay, exactly the way it's supposed to.
Saran wrap on the keyboard,
right? So then the nurse comes in, listens to my heart and lungs, and does my blood pressure, and starts the IV, and she's listening to me, and she's not wearing gloves. And she's actually touching me, because apparently I'm a frothing fountain of viral energy, right? And I'm like, okay, this is just dumb now, right? I mean, I don't think she should wear gloves. I think that's dumb. I mean, when I see patients, I don't wear gloves. I mean, I damn near don't wear pants. So I do wear pants. Gosh. That's a joke. That's a joke. Okay.
He wears shorts, short pants.
So lederhosen only, because it was Sober October. Oktoberfest. Sober October shouldn't be during Oktoberfest. That's really dumb. But that's
it shouldn't be during my birthday month. It's really dumb too.
Right. So, but Drunken December's coming. So yeah, things are looking up. So anyways, I'm sitting there and I'm like, okay, whatever. The professionalism that I am witnessing is starting to make me not as pissed off, because I'm pretty frothy. I'm like, this is just like when is it enough? Like, when is it enough for like when is it the point where you go, why would I believe anything you tell me medically when you're wearing a freaking mask that has done nothing for a respiratory virus, when the pandemic is
It's
clearly
It's
over.
flu season, buddy.
No, but like why would I like there's a point where you start discrediting your medical credibility for everything you do, because what you're doing now is so completely insane and unscientific. And then it hits me. I roll over to grasp my book that I'm reading, which is a great book, excellent book, great book.
I was just
Best
waiting
book,
for that part. I'm like,
most
you're trumping out on us.
great book, excellent book. It's called 1983 World at the Brink. Highly recommended. So I go to get the book, and as I look at the wall, what do I see to the wall but a picture of somebody wearing a mask? And it says, please keep your mask on, even if you're in the room by yourself and no one else is with you. Why? if first of all, if the virus is that bad and that contagious and that horrible, then the whole freaking colonoscopy place should be closed, because it's so dangerous that none of us should be doing this at all. Okay. And what? Now we have like Rochelle Walensky and Biden have had 5 shots.
Well, not just them.
And 5 shots. Okay. And everyone else, well, everyone in the world has had COVID.
Pretty much.
I know virtually nobody. I've seen a handful of patients.
I don't think my dad has.
A handful of patients that actually haven't had it.
I don't know that he has.
Or at least haven't had it documented.
He hasn't gotten sick.
And virtually everybody else has had it and had it documented, right? Okay, so virtually everyone's had COVID.
I agree with you. Most
Tons
people
of people have been vaccinated with a vaccine that clearly doesn't do jack shit for stopping transmission and probably doesn't do anything good, but whatever, that's another bunny trail.
And you need to wear your mask.
But I still got to wear my freaking mask so that I can go in there and they can try to make sure that my colon doesn't kill me.
It is pretty ironic, isn't it?
And I'm just sitting there like literally I'm like, why would I believe anything you tell me? I mean, it's like it's like the doctor comes in to do the colonoscopy and he starts putting crystals all around the room so that the energy forces in my asshole are focused to get rid of the cancer. It's like, no, I don't believe anything you're going to say after that.
Tell us how you really feel. You're going to die from a cerebral vascular accident from stroking out from the anger you're carrying.
A lot of anger. The way to deal with the anger is to get it out and then have some whiskey.
Yeah, there you go.
That's the key.
Have some whiskey.
Yeah. Frisky with the whiskey.
Feel better now? Getting all that out of your
I feel amazing.
system?
I feel amazing. I feel almost as purged as I was 2 nights ago. After drinking 2.5 liters of colon sudsy wudsy.
Num num nummy.
After my 20th shitini. It was awesome.
Spectacular.
Ooh.
I'm just speechless. Anyway, the whole point though, I don't even want to go down this discussion again about the vaccine and the shots, but talking with my dad who's locked up in his assisted independent / living facility where they're now on their 5th booster and flu shot and they have to wear their masks in there continuously. But oh, by the way, there's a breakout of COVID, and more people are sick.
We have a waiting list for the assisted living facilities, so let's just keep vaccinating those buggers until they die.
Can you see the irony in this, Dad? You're all wearing masks everywhere you go. Sometimes they let you take them off in your room when you're by yourself. And oh, by the way, you're on your 5th vaccine. You want to know if you should get your 5th vaccine, and people have COVID in the building. So,
well, you understand.
How well is that working for you?
You know, because I am such an epidemiologist, you understand that the highest rate of growth in sexually transmitted diseases, or as they like to say now, sexually transmitted infections. Is in people over 65.
Oh, so they should be screening for those.
No, they should all be wearing condoms 100% of the time with their masks, because you never know when they're going to spontaneously have to hook up with the lovely 80-year-old across the hall.
Somehow, since my parent is involved in this discussion, I'm just making cringy faces.
Well, you never know.
Nasty.
Would you like me to take off my mask?
Stop.
No, the insane. Like, there's a point where you just kind of go, like,
Anyway, so
clearly, can it get more insane?
let's
The
talk
answer is,
about
I
your-
guess it can.
let's talk about your colon some more. So you haven't got the results back from the biopsy
We
yet.
did.
Oh, you did.
I got them back like
Just when they were calling right now, or when?
10 minutes ago.
10 minutes ago. And so you.
So I'm going back in 5 years,
going
kids.
back in 5 years.
Mm-hmm.
Lucky you.
Well, yeah, I mean, it's better than having colon cancer, and I get at least I get the propofol. Like, if you've never had propofol, it's the white stuff like it's instant.
It's the Michael Jackson juice.
Yeah, except
basically,
you shouldn't
it's the
get
name
it
of it.
and have no one monitoring.
I didn't
It's
tell
just
them
like,
to
you
do
should-
that.
you
I was
should-
trying to so that they could relate it.
Yeah, it's
to
just
what
it's
it
just
is.
a little dangerous when you hire a guy to inject you and then like he's in the other room watching movies.
Anyway, it puts you to sleep quick and you can wake up quick. And I like when you get it because if you try to fight falling asleep, that's what I do. And I just giggle all the way to sleep.
He injected it really
Oh.
slow, and I was getting a little bit nervous that I was like,
Are you going to be awake?
I do not want to be violated while I'm awake.
Oh my gosh. You're a doctor. You know what goes on in the room when people are asleep, or supposedly.
They're like, oh my gosh.
They tell
I'm
tell
sure-
silly jokes, and
I'm sure what they're saying about me is,
I'll just leave it at that.
that
I don't want to throw
I
our profession
think-
under the bus.
I think he's one of the 7 dwarfs, but he would be Flexi.
Flexi.
Flexi, the 8th dwarf.
Oh, you're funny. You're funny, the 8th dwarf. Well, I think you should wrap your
enough.
colon up into a knot, put a bow on it, and put this one away.
That's why, yeah, you can see why it was called, this episode is Tim Loses His Shit.
Yeah, you did. You did lose your shit. Not just a couple days ago, but even today. Why was I?
Well, there's just so much.
Why was I doubting
stupid-
your
Like,
abilities?
there's only so much stupid that you can deal with.
Yeah.
And this was just like that.
I'm
Like, just
trying to-
make it okay. At least if it's a religion, you go, I don't agree with that religion, but people have their beliefs and all the rest.
Well, it
all
is
of
a
those things.
religion.
But at least be honest about it, right?
This
Like,
is
at least be
becoming a
honest about it.
religion.
Say, I'm Catholic, and I go to mass 5 times a week, and there's some stuff in the church I don't necessarily agree with, but it really gives me comfort, and I believe I'm going to heaven and whatever. You go, okay, how do you not respect that, right? Somebody sincerely held belief. But this is just people just going along because somebody told them to do something completely irrational.
Until we leave.
That's what drives me so nuts.
Until we quit working or living in this fine state, I think you're going to be able to rant and rave about this topic until the end of time, because I don't really see it changing much in Oregon. I don't see it getting through flu season, anything changing.
Well,
once you put this into, I think it's permanent in healthcare facilities, the masks in Oregon.
if you
I
really
do.
want to see me lose my mind, when we talk about Proposition 111.
Yeah. Well, it was election day yesterday, and
Well, 2 days ago,
I
because
think I
this
need
will
to check
air.
your blood pressure.
Yeah, because this will air.
Yes.
Wow.
2 days
Nice.
ago from when this airs. Anyway, this week.
Yeah,
was
on election day, I had a colonoscopy. So guess what? It wasn't just the Republicans that took it up the ass.
You're going to offend some of our listeners, but you don't care.
Well, like, that's never happened.
Fair warning. All right. So, what was I going to say? I lost my
that's-
train of
like,
thought.
yeah. I am an equal opportunity offender. And if you've listened to us before, you know that we are quite conservative.
And
But
so
yes,
if you're
the
still a
Republicans
listener,
took it
you're
up the
here
ass.
because you don't care. We are coming up to our 100th episode soon. And if you look at this one, you'll know that. So we are thinking about doing a really fun giveaway. If you have any thoughts, let us know. But
Well,
we will
actually,
be,
I think I'm going to give away
what, photos of that?
framed
I
framed
think
photos
we should. I think we should.
of my colon. I think
would-
that would be a wonderful
Mhm.
prize.
That would be just beautiful. In fact, I think we should put it up on our new wall back up here in that spot right beside you.
Mhm.
But yeah, we're thinking of having a 100th episode celebration giveaway contest ahead of time. So be on the lookout for that over the next couple of weeks. And Also, remember to check out our sponsor, who we love. It keeps us fit and healthy, is Oregon Valley Farm, OregonValleyFarm.com, where you can have the best. I'm not saying this because they're a sponsor alone. It's because we have been using this long before they sponsored us.
Well,
Love
yes,
their
and I
meat
just want to
products.
throw out something. When I do this, we're watching Billions. We're hooked on the show Billions. So I'm doing my Chuck Rhodes hand.
Oh, there you go.
So
Oh, good.
if anyone
that
knows
means
that,
I get to be Axe.
my Chuck Rhodes hand. So the other thing is, for sponsorships, we have actually reached out to people. So we are trying to get people to that, kind of are part of what we believe in what we're doing as far as trying to get the truth out there about a lot of things that people don't want to talk about in medicine and stuff we like. So that's really how it's worked. So if we're selling something, it's because it's something that we use.
Yes.
So
we have been approached by some people to endorse their product, and we take a big fat pass.
Like when we were approached by Tampax, and I said, I don't really use that, so I can't endorse it.
Well, I could see.
And they said, look,
I could see by
they said, look, we'll pull a few strings.
I could see by the look on that picture where we could put a few.
Yeah.
There you go.
We'll pull a few strings for you. Get you. And I said, no, I'm sorry. I don't believe in that product.
Be nice to me, or I can find a place to put it for you.
Yeah.
There you go. So yes, we, if you happen to know of anybody that has a wonderful product, or if you are a business owner that would like to sponsor our show, please reach out to us, because we would love for you to be part of the BS Free MD podcast. And
hopefully after this episode, you still want to be part of it.
There you go. Check us out on Instagram and Facebook, and share our podcast with a friend. The best thing that you can do to help our podcast grow actually is share it with the person. And also, if you rate us and give us a like on Apple, for instance, it does push the algorithm up so that we get seen by more people searching for medical podcasts. So, when everybody's always asking, please rate and like us, it really does help. So
5 stars, just like my 5-star colon.
So when
prep.
you hang up, when you finish listening to this episode and you haven't rated us and given us a nice 5-star rating, please do so. It doesn't take very much time at all. You can also rate it on Facebook as well. So thanks again, everybody. And we will be looking forward to our next episode with you next week. Send us your comments and questions. BSFreeMD.com is BSFreeMD.com is the website, or doc@BSFreeMD.com. It's no secret that medicine is a bit uptight. That's why Tim and I created BS Free MD, to mix things up a little and have fun in the process. Besides, we are having these exact same discussions all the time, so we thought we might as well invite everyone to the party. If you really like us, you can get plenty more, and maybe see one of Tim's cool tattoos on our Instagram or Facebook pages at BS Free MD. See you next time.
While we try to keep BS Free MD as raw and real as possible, we can't be held responsible for any medical decisions or discussions had as a result of what you've heard on the show. We know, bummer. But the truth is, we really do care about your questions. So feel free to reach out to us by email at doc@bsfreemd.com.